Parkinson's disease, it is an idiopathic chronic degenerative disorder of the central nervous system, and it is characterized by disability from tremors and rigidity, and it affects mobility and locomotion. There are many stages in that Parkinson's disease. That is first one, stage 1. In this stage there is presence of mild symptoms, but in that patient is good to about daily activities. And stage 2, the presence of symptoms, example tremors and stiffness, and slow of movement it begins, and again begins to it is worsen till, and in this stage it develop the poor posture. And stage 3, there is a presence of in that patient loss of balance and loss of movement. This also it begins to slow down. Next, stage 4, the severe symptom is developed, and it causes the patient day life in any activities. In this stage the patient is require family help to do the daily activities. And stage 5, at this stage the patient walking and standing it may be impossible, so in that the person is confirmed to a wheelchair or a bed rest. These all stages. And next one, there are types of Parkinson's disease. Types of Parkinson's disease, there is first one, idiopathic Parkinson's. Idiopathic Parkinson's means in this condition the most common symptom is present, that is tremor, rigidity and slowness of movement. Next, second one, vascular Parkinson. It is also known as arteriosclerotic Parkinson's, and this condition it affects people with restricted blood supply to the brain. The common symptoms are vascular symptoms are the problems with memory, sleep, mood and movement. And third one, drug induced Parkinson's. That is in this condition it is only affects small number of people, and this condition is recovered within month, within days or within weeks. And other type of Parkinson's, it is multiple system atrophy. Multiple system atrophy, in this condition is called the stiffness and slowness of the movement in the early stages. And progressive supranuclear palsy, it affects eye movement, balance, speech and swallowing. Next, normal pressure hydrocephalus. In this condition it affects the lower half of the body. Next, etiology of Parkinson's disease. There is exact etiology is unknown, but the possible factor it is associated with the Parkinson's disease are that is a viral infection, it any viruses or bacteria or microorganism, and family history. Those who are having the history of Parkinson's disease, then next generation they are getting the Parkinson's disease. And next one, environmental factor. That is environmental factor, it is linked with some diseases, that is head injuries, those who are having the head injuries, and pesticide exposure. Okay, they are exposure to the pesticides, and air pollutions, example like road traffic, this, and those who are living in the rural areas. And next, drugs and toxins are that is antipsychotic drugs, tetrabenazine and lithium, manganese. These are the toxins or drugs, uses of the drugs. Other degenerative diseases, then it comes after that progressive supranuclear palsy. The person is having progressive supranuclear palsy, that is it affects in this condition it affects the eye movement, balance, speech and swallowing. After that there is a chances of get Parkinson's disease. And dementia with the heavy bodies, and dementia means the loss of memory. And multiple system atrophy. Multiple system atrophy means in that it causes the multiple system and in that stiffness or slowness of the movement, it is in early stages. And next, Alzheimer's disease means it slows the slowly destroy the memory, and it destroy the thinking skills. Alzheimer's related degenerative disorders. Next, risk factors, that is age, increase the ages of the age, example 57 years of age, and sex, that men are more affected than women, and those who exposure to pesticide and herbicides, they are getting the increase the risk of Parkinson's diseases. And the next one, family history and hereditary history. In that, the family members are having the Parkinson's disease, and then next generation they are getting the more increase the risk of Parkinson's diseases. And next, trauma to a head or neck or upper cervical spine. In this case, the person is increase the risk of Parkinson's diseases. Next, pathophysiology. Pathophysiology due to the etiological factor. Example, already we discussed etiology. Due to the etiological factor, okay, it leads to it is destruction in the dopaminergic neuronal cells. Means alteration in the dopaminergic neuronal cells in the basal ganglia. These changes or destructions of the neuronal cells in the basal ganglia, in that it is reduced level of the dopamine level. This reduced level of the dopamine level, it is cause the nerve, and it cause loss of controlling muscle activities, loss of muscle control, and the it is in the imbalance between the excitatory and inhibitory neurotransmitter in the corpus striatum in the brain, and the presence of the symptoms, that is tremor, rigidity, and bradykinesia. Next, clinical manifestation, that is the main clinical manifestation already we discussed, that is tremors and bradykinesia and rigidity. In that tremors, it is a uncontrollable shaking of a limbs or other part of the body, and actually it is begins in the hands or arm, and in that the patient is stressed and anxious. Okay, when it is occurs means when the patient is stressed or anxious. Next, bradykinesia, or it is also called a slow of movement. In that it is derived from Greek word brady means slow, kinesia means movement. Okay, slow movement or slow motions. That is example of slow speed doing a task, or difficulty in turning a bed, these are. Next, muscle stiffness or rigidity. Muscle stiffness or rigidity, it is caused by increased muscle tone and excessive continuous contraction of the muscles. Next, motor symptoms, that is reduced eye blink, dysphagia, dyskinesia, these are. And impaired posture and balances, and speech changes, and changes in the writing style also, and non-motor function, that is sleep disturbances, edema, fainting, sexual dysfunctions, and sensory symptoms, that is loss of smell, loss of sensation or pain, and depressions. Next, diagnostic evaluation. The exact specific test of diagnosis is Parkinson's disease is no. But we are collecting the complete history of the patient, and neurological examination and physical examination. According to neurological examination, physical examination, we are doing the diagnostic evaluation. Example, MRI scan, X-ray, and positron emission tomography. These all tested be done. Next, management, medical management. First, we are giving in that medical management the drugs, that is anticholinergic drug. Example, trihexyphenidyl, this action of acetylcholine to control the tremor and salivation. And next one, catechol O methyl transferase, that is entacapone. It blocks the enzyme and it prevents the breakdown of levodopa and prolonging levodopa action. And dopaminergic, it is a neurotransmitter class of drug, and amantadine and levodopa. Next, dopamine agonist, bromocriptine. It activates dopamine receptor in central nervous system. Next, antihistamine, that is diphenhydramine. It is used for tremor and rigidity or insomnia. And monoamine oxidase inhibitor, that is selagiline, and it helps to inhibit monoamine oxidase B. Next one, surgical management. Surgical management, in that first surgery is pallidotomy. Pallidotomy surgery, it is used for the patient who's having rigidity, tremor and bradykinesia. These are uncontrollable, means in that surgeon is creating a small lesion in globus pallidus, then to treat the tremor. Okay. Next, thalamotomy. Nowadays the thalamotomy surgery is rarely performing during this. So this surgery also to treat the tremor at one side of the body, and in this surgery also surgeon is creating the lesions in the thalamus. Next, deep brain stimulation. Deep brain stimulation, in that a device is implanted and in patient, and it after that it device is delivered the electrical impulses to a brain to decrease the motor symptoms. Next, complication. Nursing management, it is improve mobility and enhance self-care activities, improve elimination, improve nutrition, enhance swallowing, improve communication, support coping abilities. These are nursing management. Next, complication. Main complication, it is the sexual dysfunctions, cognitive problems, depressions and loss of control and smell dysfunctions. These are complications.